Hi, I am Amelia Santiago. I'm a PTA student with South College. I'll be demonstrating different pressure relief techniques that we can do. Usually we try to do these to avoid developing any pressure injuries such as like ulcers. You want to hold the technique for 1 minute and you want to try to do them every 15 to 20 minutes. So the first one that I'll be demonstrating will be the lean forward. So you just lean forward, you try to get off of your buttocks or your bottom and you hold that for a minute, and then another one would be the leg crossing. So you would hold one side for a minute and then you would do the other side for a minute. Then the next one will be the tricep hold or so you go up and you hold this for a minute if you can. This one is a little more difficult. But yeah.
So we're going to do some breathing techniques such as diaphragmatic breathing, which creates extra expansion of the lungs, allowing for deeper breathing. So you're just going to try and push out your hand while it's on your stomach.
So for this, sit and then just walking your hands forward.
Perfect. The next breathing technique we're going to do is glossopharyngeal breathing. So you're going to make a gupping noise while you breathe in air, and that will allow you to inhale more oxygen than you would with a regular breath. So we're going to do that now.
Would this work? I think it'd be better to do it seated.
Next, we're doing assisted coughing technique to help clear out mucus for a patient who can't necessarily do that for themselves. So, you're going to instruct the patient to breathe in and then try and cough, and at the same time you're going to push up on their diaphragm. So if you'll breathe in and cough. Great.
So I'll be demonstrating how to stretch your shoulders, your hamstrings, and your hip flexors, okay? So this is to avoid developing any contractures and to improve the motion that we want to go into. Usually a stretch, you would try to hold between 30 to 60 seconds. So let me demonstrate shoulder. So you would try to go into a counter or a table. You can do a stretch, 30 seconds or 60. Good job. Now, to stretch your hamstrings, you're gonna try to get more surface area by slightly bending your opposite leg, and then you want to have externally rotate your arms, and then reach over and stretch. Like I said, 30 to 60 seconds. You want to hold stretch. And you want to externally rotate this arm to help you for balance. And then do the same thing for this leg. Slightly. There we go.
Okay. Get yourself up, enough elevation.
Externally rotate and then reach.
So finding that like high knee.
Great.
To stretch out your hip flexors, you would try to go on your stomach or prompt position. Then you would use the momentum of your head to try to go onto your elbows.
Yeah.
And then we would use
I only have to do one.
sorry. Your scapula to help with that stretch to guide you up. And then feel that stretch on your hip flexors. Yep.
I probably would do.
This is how you descend and ascend a curve in a wheelchair.
Okay, we got it.
To ascend and descend a ramp, you are going to go in a zigzag pattern on your way down. So just to the right and to the left. Perfect. And now we're going to go up the ramp doing the same zigzag pattern.
I'm going to be demonstrating how you would sit in a wheelchair while using the imaginary cave. So you want to get that head hip ratio. Get close to the wheelchair. Make sure that the wheelchair is against a cabinet or just the surface that you know it won't move. Make sure to lock your wheels.
After our pre-gate activity,
you don't want to be moving around. Okay, my wheels are locked.
Correct mechanics. And
Okay. So then
pattern.
you want
I'm
to
gonna move my left extremity first, followed by
make sure to get your
lower
hands near the
extremity,
armrest.
then the right
Take
upper
this off.
extremity, followed by the
Then
left lower
leave that
extremity.
there.
All together, it would look like this.
Put that there. You're trying not to bend your knees because you have your KFO. You don't want it to break. Okay. So then
If
you
the
are
foregate was too advanced, we can work on
and then sit down.
what is it called?
Perfect.
They're not
Okay.
the other
We're trying to go into a standing position. So you want to grab your locked string,
We told them about
also known as forearm crutches or Canadian crutches, whatever they're called. I mean, however you want to call them. Okay, then you want to put those to the side, and then you want to use the head-hip ratio.
Student Affairs Coordinator.
Okay, there we go.
Okay, I'm going to show how I would get from wheelchair to the floor and then the floor back to the wheelchair. Wheelchair is locked.
If I could just get rid of this lower belly right here, I would have so much better self-esteem. Strongest thing.
So now I'm going to demonstrate how to do a pre-gate activity to prepare for gate. We are going to be doing it in a quadruped position, which is you are on all fours. And face my way. Okay, then she's gonna be reaching out to grab this, down, reach out to grab this, down. Okay, the reasoning why we're doing this is for weight shifting, and this is due to because whenever we are ambulating, we are also weight shifting and working on our EO-IO for balance.